In fact, the amendment, Senator from Mississippi, would deduct dollar for dollar from the UN Population Fund the amount it spends for a program in China. The bill already does that. So, for all practical purposes, the amendment, the junior senator from Mississippi, does nothing that the bill doesn't already do, with one exception. His amendment would also strike the 6 limited purposes that are specified in the bill for which funds are made available to the UN Population Fund. He would strike the money which is provided to promote the abandonment of female genital mutilation and child marriage. Now, frankly, why would we want to cut out money to help encourage the stopping of child marriage? Is there anybody in the Senate in favor of child marriage? Is there anybody in the Senate in favor of female genital mutilation? I find it amazing I have to even come on the floor to talk about this. But yet his amendment would remove the money we have in there to try to stop child marriage, try to stop female genital mutilation. Why should we vote for something like that? Do we want to prohibit funding to reduce the incidence of child marriage in countries where girls as young as 9 years old are forced to marry men they've never met, sometimes 5 times their age, who then abuse them? The bill also provides funds to prevent and treat obstetric fistula. Now, for those who are not familiar with this, it's a terrible, debilitating condition that can destroy the life of any woman who suffers from it. It can be treated with surgery. I'd ask unanimous consent that the February 24th article in the New York Times on obstetric fistula be printed in the record at the end of my remarks.
Without objection.
Why we would want to prohibit funds to save the lives of women who otherwise could die or be totally debilitated for the rest of their lives, I cannot understand. There is none of us here who would hesitate for a moment to provide funds to help a woman in our family who might be in this condition, but we're prohibiting. I see the senator from Mississippi on the floor. His amendment prohibits money to be spent for that. We have funds to reestablish maternal health care in areas where medical facilities and services have been destroyed or limited by natural disasters, armed conflict, or other factors, like in Pakistan after the earthquake destroyed whole villages. Why would we not want to reestablish maternal health care? Again, any one of us with our sisters, our daughters, our wives, we'd want them to have maternal health care. Why? I can understand why the senator from Mississippi wants to prohibit funds to some of the poorest of the poor countries for that, or in Congo, where armed conflict has destroyed where limited health services existed, and where thousands of women and girls have been raped, some barely old enough to walk. Now, this bill provides funds to help them. The senator's amendment, the senator from Mississippi's amendment, would prohibit us having money to help these thousands of women and girls who've been raped. Funds are provided to promote access to clean water, sanitation, food, and health care for poor women and girls. His amendment would prohibit that. I can't understand why we would want to prohibit such things. I mean, I've traveled different parts of the world. I've seen the difference in the lives of women and young girls we've made with these funds.